Not a matter of if, but when crisis will rock your world. I'm Roshini Rajkumar, crisis strategist, licensed attorney, and host of The Crisis Files. In each case file, we explore a real-world dilemma. My crisis squad and I seek solutions. I also turn to insiders who are fighting battles most don't even know are brewing. Paul Funk is a retired four-star general in the United States Army. His accomplishments include overseeing the training of 600,000 soldiers. He now works with leaders to drive results in must-win situations. General Funk is here for the case file I call Fit to Serve. General, first of all, thank you for your service. You're here today because there is a crisis in military recruitment in the United States. The U.S. is in its 60th year of an all-volunteer force, but in a country of about 380 million, less than 1% serves in uniform. Some of the reasons might be surprising, right?
Thanks for having me on, and thanks for highlighting this issue of a strategic dilemma in our nation. We have to defend the nation. And so every time somebody says, thank you for your service, to me, I like to respond with, well, you're worth it. And frankly, the American people are worth the service and sacrifice of America's military.
I love that you say that we're all worth it, because some days, General, as we watch what's happening in the United States, I wonder if our military servicemen and women really lose a little faith in us, who you are all protecting. But that being said, this crisis of recruitment is happening in kind of ways we might not believe. I, for one, thought it was you weren't getting as many people to volunteer. Maybe that's part of it, but there are some deeper things at work.
That's exactly right. The numbers are about similar to what they've always been. And one of the problems with that is now we have a problem that we have several things that are coming together to cause this crisis. One is obesity. The other is the pandemic and the lack of educational aptitude for the last 2.5 years in order to be able to pass the Armed Services Vocational Aptitude Battery, or the ASVAB test. We have a culture that's kind of troubling in terms of using drugs to kind of shape behavior and not recognizing that some of these things might be disqualifying for service. Some of the percentages are a little stark. Frankly, only 22% of America's youth is fully fit to serve in our military as we speak. That means 78% is not. 38% of that is actually due to obesity. So we have a crisis in our nation and really in the world as you start to look at it, but a crisis in our nation as it relates to our weight. Then you throw on top of that 2.5 years of COVID, kids just didn't get the requisite skills they needed to pass the ASVAB test. Then you bring in a piece of that, which is some form of drug, whether it be prescription drugs or illegal narcotics, or for example, we don't have a national marijuana policy. And all of those things are disqualifying for service to the nation right now. So we do have a crisis on our hands in terms of finding the right people to serve. So we want to maintain an all-voluntary force for exactly those reasons, is that an all-voluntary force is willing to serve and sacrifice for the greater good of the nation.
Let's unchunk this a little bit, General. So bunch of red flags are flying here for me. I have so many questions. Let's start with the drug piece of this. You note, and it's so true, there is no national marijuana policy. Each state is really being allowed to do what it wants to do, get its voters to vote. But that kind of screws up things at the national level, and you're helping us understand why that could screw up things for the nation's military. So get into this prescription drug or recreational drugs and why that matters and how military recruiters as well as medical testers are looking at this.
At last count, at least when I was still on active duty, which was about 14 and a half months ago, there were 39 states and a district that had legalized marijuana. But we haven't done it nationally. And I'm not advocating either way. I'm just saying we don't have a policy. But we do have a policy. Our current policy is if you have THC when you take your physical to come into the military, you are disqualified. Sometimes you can retake that after 30 days. Sometimes it's 90. And if you fail a second test, some of the services, it's completely disqualifying for life. Same is true in some states We have a policy that if your parents are divorcing, the children have to go to counseling. And that becomes a red flag for requiring a waiver to serve.
Counseling itself requires a waiver. No drugs necessarily involved, no prescription
Not
drugs involved.
necessarily drugs there. Then if you take that category of young men or women who are on various mental health drugs, there are certain ones that are disqualifying. I don't have the entire list in front of me, but frankly, it has become enough that it is impacting our ability to bring quality young men and women into the service without some form of getting them to stop taking those drugs that they may have needed for their own mental health. That brings on another set of circumstances when that drug may run out of their blood system while they're trying to get in their service. So it compounds itself frequently, actually.
Yeah, it really does. And probably something that we don't think about. And I wonder how many of the people who are actually wanting to get in and pass the military tests really understand these layers. Maybe their parents don't understand these layers. Okay, so we've got that drug piece, prescribed, legal or illegal marijuana, however you want to look at that. And this, to me, is something I will say, in my opinion, the United States has not really wanted to take on the issue of obesity because people are concerned about body shaming, fat shaming, whatever you have it. We here on the Crisis Files, we believe everyone is human. We try to treat them humanely. We've covered body positivity, body neutrality topics in the past on this show. But frankly, I've talked to insurance types about this. Obesity is a national epidemic, especially when it comes to coverage. And frankly, insurance companies are concerned they're not going to be able to cover people. And now you're telling us it might prevent having a full military force to protect the United States in the places where we need military.
That's exactly right. And frankly, it is a huge national security problem. And we got to attack it. President Eisenhower and then Kennedy enacted it. But we started the president's physical fitness test when the president became alarmed the fact that only 50% of the youth of America were fit to serve in the United States military. Now it's down to 22%. We have stopped the president's physical fitness test, but the Army's found that it's not just about the physical. It is, in fact, about what we would call holistic health and fitness. And I think you're starting to see several studies that are finding that there are major aspects to wellness that are absolutely important. There's the physical, the mental, the spiritual, and the spiritual not necessarily in a religious, but what are your beliefs? What are the things you absolutely find as bedrock to believe in when you're going through hard times? And then there's nutrition and sleep. Those 5 things round up what we call the holistic health and fitness program. And in that vein, we've allowed ourselves to start attacking this obesity epidemic in that manner, at least in the United States Army.
Tell us what you're doing. I'm sure people would be really interested in that plan.
The Secretary of the Army and the Chief of Staff of the Army have invested a ton in holistic health and fitness program drivers, which are occupational therapists, physical therapists, athletics trainers, strength and conditioning coaches, military family life counselors, our chaplain program, our counseling programs, and have really started to formate. We have a nutritionist that's going into each and every one of the brigades in the Army. That is changing our dynamic. We've changed our entire way we feed in our warrior restaurants. All of this comes together to attack this through the lifetime of service, because if we only get a certain amount of people come in to serve, we have to treat those young men and women like the warrior athletes we need them to be, because the future battlefield is going to be very, very, very complex, very lethal, and very much require endurance beyond what we see right now.
Let's be real. I watch all those TV shows, whether it's, Army, Navy, whatever on TV, and I know that they dramatize things, but there are very fit people that are cast to play those roles. And there's a reason for that with some of the work that you have to do. I want to make sure people also understand that you are trying to help young men and women who don't pass the test, but they still want to serve. What are you doing there?
the Army started, and I think the other services are now rallying around, is what we call the Future Soldier Prep Course. And in that is a young man or woman conditionally gets into this program and trains in the physical, mental, spiritual, nutrition, and sleep. They get into this program, and it's a 90-day program, and they can actually change their lives. And that's what it's designed to do. It's designed to help us as a nation overcome part of this obesity problem, or the lack of education piece, or the lack of sleep, or the lack of nutrition, or the lack of believing in something, by taking a Future Soldier Prep course at Fort Jackson and allowing young men and women to compete to serve. So once you meet our standards, so we never wanted to lower the standards for enlistment. So how do we do this? We bring them in, we train them, we take them through this holistic health and fitness program. We have educational counselors to help them through the Armed Services Vocational Aptitude Battery. And then once they meet the standards, we enroll them into the basic training course, the next one to start, and they begin their journey into the United States Army. That's how we're working at. That last year, I believe there were somewhere almost in the neighborhood of 10,000 young men and women who qualified to serve through that program.
Well, General Funk, I mean, this is a great template for not only the military, but for a lot of industries out there as far as caring about wellness, mental, physical, spiritual, for their people.
Yes. The whole piece of this is we have to understand if we want to maintain an all-volunteer force, we're going to have to treat them like warrior athletes. We're going to have to train them that way. We're going to have to pay them that way. And frankly, we're going to have to turn them loose when it's time to turn them loose. In my opinion, this is nothing but benefiting the nation by having these young men and women go through these kinds of courses.
Totally agree. Let's do a little future casting. In countries such as France, Israel, Ukraine, Russia, it is required for men, for certain, to serve in their military. In South Korea, men and women are required to serve for a duration of time. What is your prediction, if you will, for the United States, where we are currently a volunteer force?
Well, I think we will preserve the all-volunteer force. I think the American people will once again begin to see the benefits of serving the nation. I think that if we continue to do that, if we continue to improve what it is we're doing, if we continue to improve the leadership training that we're getting in the force, I think you'll see that the people will start to come back to the force, and we'll be ready for the next whatever crisis that comes along.
Well, I love it, and that's a great positive note to wind down. Thank you, General, for taking us through this national crisis. Connect directly with General Paul Funk on LinkedIn. Today's Crisis Brief is brought to you by Minneapolis Regional Chamber. Number 1. Military leaders call this period of time one of the most dangerous in United States history. Your decision to serve is more valuable than ever. Number 2. Now is the time for the U.S. to address obesity head-on as a national security imperative. Make your voice heard. Talk with your legislators. Number 3. Thinking about serving and wonder if you meet the standards? Check out the Future Soldier Prep course at goarmy.com. The Minneapolis Regional Chamber is a proud sponsor of the Crisis Files podcast. The Minneapolis Regional Chamber is the area's most active business advocacy organization, playing a critical role in top issues impacting the region, including workforce development, education, housing, and transportation. Make your voice heard by becoming a member of the Minneapolis Regional Chamber. Learn more at mplschamber.com or Google Minneapolis Regional Chamber. Rate, review, subscribe to The Crisis Files on your platform of choice. Check out our very new website, thecrisisfiles.com, to catch up on all case files. Follow us on YouTube and Instagram at The Crisis Files. I'm Roshini Rajkumar. Join me next time on The Crisis Files.